the most common reasons that moms talk about giving up or stopping breastfeeding or not continuing is the pain that they're experiencing, the nipple pain that they may be experiencing while they're breastfeeding. And so many times people moms will ask me, is it normal to have pain while breastfeeding? And it's such a loaded question because initially you may experience a little bit of pain when you're nursing and your breasts are getting used to it. And I know you hear things of saying, you shouldn't have any pain, there should be no pain with latch, which is true, that as you start to get into breastfeeding and the days start to go on, you should not be experiencing a painful latch or there's something wrong that needs to be corrected or adjusted. But initially you may feel a little bit of pain as your nipple is just not used to the baby breastfeeding, and this can sometimes cause some soreness and pain as the nipple is sort of getting used to a baby latching on several times every couple hours all day long. There are a couple things that I want to bring to your attention when it comes to nipple pain. And one of the things, the best advice, and when I talk about this in my Simply Breastfeeding class, the online class that I have, I have a whole chapter talking about preventing sore nipples. And why I say that is because the very best way to deal with nipple pain is prevention. How do we prevent this from happening in the first place? And there are certain ways that you can go about. Obviously, you've all heard a good latch is going to be your #1 way to prevent your nipples from being sore. The baby needs to latch really deeply onto the nipple, and so therefore the nipple is way far back in the baby's mouth. The baby shouldn't be sucking directly on the nipple. If your latch is right and your latch is deep enough, meaning that there's enough of the breast tissue into the baby's mouth, the areola, and that you're holding your baby close enough, your nipple should be so far back. If you reach with your tongue and you feel right now where your hard and your soft palate meet in the back of your mouth, that's how far back your nipple should be with a good latch. It should not be that your baby's sucking right on the tip of your nipple. That is definitely going to cause soreness, and that's what we consider a shallow latch. Okay, sometimes bringing the baby closer in, getting the baby to open their mouth wider when you're latching, and positioning. These are all things that are going to help to get a deeper latch and a nipple farther back in your baby's mouth. Another thing that I discuss in depth in my class is the idea of shorter and more frequent feedings in the first few days, especially prior to the milk coming in. This is like day 1, day 2, day 3, day 4. These days, not all babies will come out wanting to nurse a lot. Most babies are very, very sleepy in the beginning, and that creates a whole other consideration and issue where babies are supplemented, maybe they're not eating enough. That's something else we'll talk about in another video. But then what about those babies that just want to come out and want to nurse all the time in the first few days? What you'll find is a lot of encouragement, especially from the nurses, the lactation consultant, people around you to say, oh, that's great, they want to nurse, let them stay on as long as they want. This is not, in my experience, working with thousands of moms, this is not the best advice that I can give to moms. And in fact, I'm pretty clear in my program about how to specifically limit the length of those early feedings, while doing them as frequent as the baby and more frequent as the baby wants to eat, but limiting the length of how much time you're spending on each breast, especially in those first 2 or 3 days, to give your nipples a chance to work up to those longer feedings and to not create the soreness when really all there is colostrum at that point. That's a few drops. It's a teaspoon of milk that's coming out, and so your baby's not really needing large volumes of milk to eat anyway, and really all you're doing is creating potential soreness when you go home from the hospital. That's when nobody's seeing you anymore. And so I think it's really important to kind of balance that out. And like I said, I go into way more instruction on this on my Simply Breastfeeding program on my website if you're interested in learning more about it. The other thing is what happens when you're already sore. Okay, great, so I didn't do that, I'm sore, or I did do that, I'm sore anyway, what do I do now? One of the best things that you could do is actual breast milk on the nipple, just expressing some milk, putting it onto the nipple, leaving your bra open, leaving your shirt open, obviously while you're at home, and just allowing your nipples to air dry and allow that breast milk to just sit on your nipples. It's very healing to the nipple. The other thing that you can do is use an organic nipple cream, one with calendula preferably. And I'm saying this because You know, nipple cream that has lanolin, and this is recommended all the time, is one that I definitely do not recommend. I would recommend getting something without lanolin. I don't like lanolin inside your nipple cream. And so calendula is very healing to the nipple, and that is one that I would choose. Earth Mama Angel Baby makes a great nipple butter that we all love, and that's great for your nipples. And even coconut oil on the nipple can be really healing and soothing as well. Like I said, the best thing to do is to prevent, and hopefully if you do become sore, you can work on this problem quickly. I would also recommend seeing a lactation consultant as soon as possible if things are not working out. They can usually, just a minor adjustment to your latch can make all the difference in the world.